chatted in June, we knew a little more, and now here we are in September. Where do we stand on this? Before we get into the specifics, how are we doing?
Well, we're doing probably as well as can be expected under the circumstances. We've had quite a long haul with this virus. I was listening to your previous broadcast on 9/11, which was very moving to listen to. And I remember 9/11, of course, as we all do, and that was an event of historic consequences, and I think it's really interesting that we're talking today as well about COVID. At that time, it was a singular event, and the country came together, and despite the tragedy, we all healed. And COVID is something totally different. It's ongoing. It doesn't go away. It's hard to point the accusing finger. And there's been, as you know, a lot of breakdown of solidarity in our country rather than coming together. So, yes, I think we're doing as well as can be expected, but we're dealing with an enemy that we don't really understand, and we're developing all new methods of attack and conquer. So that is something that I think is somewhat sobering on a day like this.
So let's talk about, Dr. Crawford, the understanding. It's what you folks in biology and virology and epidemiology, try and understand. Lay people like me, we see a microscopic image and we see, well, that's kind of interesting, but some of the most brilliant minds in the world have now spent, the better part of 9 months trying to figure this out. What are some of the things, maybe some of the latest things that we have learned, Doctor, that say 6, 8, 9 months ago we didn't know about?
Well, I think we've learned a lot about how the virus is transmitted. I think we've learned a lot about how we can prevent transmission and what the risk factors are. I think we've learned a lot about the importance of testing. I think we have found that when we've employed the appropriate social distancing measures, we have been able to bring down the incidence. And I think we're still on the quest for trying to develop an equilibrium between having a normal society and yet preventing further spread of this virus. So I think that's the cusp we're at right now. What do we do now? And I do think that the appropriate responses involve both the improved and more accessible testing modalities, as well as approaches to the vaccine. But there again, we're dealing with a fairly complicated profile, and I think one that may be, in a sense, almost a rush to judgment, thinking that the vaccine is going to be the cure-all. But I think it's going to be a much more multifaceted approach to preventing the further devastation of this virus over the next year.
Okay, I want to get into that momentarily. We have to take a break. Hang on, Dr. Sarah Crawford. We'll be right back with you. More Straight Ahead with Dr. Sarah Crawford from Southern Connecticut State University, professor of biology and a virologist, talking about what progress, if any, we are making against COVID-19. Back with more from Dr. Crawford. First, traffic and weather. Be encouraged. Connecticut Today with Paul Fuselli, WICC 600. And we continue right here on WICC 600. Dr. Sarah Crawford joins us, professor of biology, virologist from Southern Connecticut State University. Before the break, Dr. Crawford, you talked about trying to reach an equilibrium with this thing, which is kind of interesting. So do you agree to some point with some of the experts that are quoted, around the globe in various countries, including here in the U.S., that say, viruses don't go away. I mean, it's very difficult to, eliminate that. So it's going to be a question of learning to, as you say, achieve that equilibrium and coexist with this thing?
Well, yes. The virus is here. The United States has suffered an extraordinarily high toll from the virus. It's not going to disappear. This is a new world, and the new world is one in which we're going to be more careful about human-to-human transmission of viruses. about the conditions which may cause these viruses to develop in the first place, and developing more effective preventive vaccine approaches as well as therapeutic protocols. So I really think that this is a very eye-opening experience for the world and for the United States as far as our culture is concerned. And we're going to have to learn that this is the new normal to some degree. Now, we're not going to walk around frightened of becoming sick, but we're going to develop a culture in which when we're faced with this sort of event, which may happen again, we're going to have rapid testing. We're going to be on gear for developing vaccines and therapies. And we're going to, as a society, pay more attention to both health care and healthcare research, which is something that for a long time we kind of assumed wasn't that important because everybody basically lives a full life here. This is not the 1920s before antibiotics. So, we're a bit complacent, and which is understandable. Who expected this to happen?
No, sure. And I did read something from a gentleman, I think it was months ago at Harvard, and he kind of said something interesting. He said, look, in the future, once we get over the initial bad part about this, he said something, doctor, that you kind of just said, society will go on, but when we have flare-ups of this, there's going to be a percentage of society that should be okay, just take some precautions if they are relatively healthy. Then there's going to be a portion of society that's going to have to take some, better precautions, but still should be okay. And then there are going to be the people with high comorbidities, elderly, nursing homes, and there are going to be people that are just going to have to, continue their lives inside, maybe for not months at a time, but just react to this. What are your thoughts on that?
Well, I think that's an interesting perspective, but perhaps a somewhat limited perspective. I think there might be a tiny dose of wishful thinking in there, that we can compartmentalize something like this and make it the problem of one segment of society more so than, say, the average individual. And I think that's I don't mean any criticism, but from my perspective, I think that's a very misguided thought. Because viruses can mutate, they can change. We do know that there are comorbidities associated with susceptibility to the more severe consequences of SARS-CoV-2. However, we're also seeing a much enhanced incidence in younger individuals. So I would not be so complacent to say that, we're going to take this small segment of society and we're going to say, well, if you're at risk, you're older, you're this, you're that, you better be more careful. I don't think we can make that distinction. I think that is an attitude that may be somewhat cavalier and not sufficiently sensitive to the enormity of this issue if it is not addressed head on.
What do you make of what you have seen and perhaps read about the vaccine push coming out of several countries and also some of these big pharmaceutical companies? What's your opinion so far?
Well, I've been following it very closely, as you might imagine. I remember the Sputnik 5, I think, that came out of Russia, that I don't know where that went. But anyway, it's somewhere in outer space right now. But at any rate, we do have some vaccines that are being developed in this country and in Europe, which have potential. I am a little bit concerned about the incidence of it's just one case, and I do not want to make more of this than need be. However, I do feel that it's important to take note of the fact that there is a patient, a volunteer from the AstraZeneca trial who has developed a demyelinating disorder of the central nervous system. I'm just spent the summer writing a paper on SARS-CoV-2, and it's going to be published in Medical Research Archives in a couple of weeks. But at any rate, in that paper, I go into the fact that there have been previous attempts to develop vaccines against various forms of SARS, some lesser pathogenic forms of SARS viruses, as well as SARS-CoV, and as well as related viruses such as RSV, where the virus itself may induce an abnormal immune response in a small percentage of individuals. And I think that I addressed in my paper. I hadn't seen it addressed anywhere else, and I was hoping maybe I just was focusing on one or two papers that, would not have potential future significance. But at this point, I am concerned that we cannot rush to develop a vaccine that doesn't show clear safety protocol. And I'm a little bit concerned with this latest development. I think we have to be careful about a virus that, as part of its infectious cycle, induces immune system abnormalities. Because there's always a potential that the vaccine itself might, in some individuals, produce a similar effect, perhaps, or upon challenge with the actual disease, cause a more severe effect. So I think we have to be very careful and very circumspect in terms of how we approach the development of this vaccine. And we cannot simply use our need or our hope to have a successful vaccine to override the clear scientific concerns that should be in play as we move forward in this direction. So I don't have a totally positive view at this point.
Okay, Dr. Crawford, hang on one more segment with you. I want to ask you about folks who may not want to get a vaccine. We'll be back with Dr. Sarah Crawford, Southern Connecticut State University professor of biology and a virologist. Mom wants her kids. Times Project. Well, instead of kid today, WICC 600. Couple more minutes with Dr. Sarah Crawford, Southern Connecticut State University professor of biology and a virologist, as we talk about what progress we've made on COVID-19. Dr. Crawford, dovetailing over our last couple of seconds about the vaccine, I am really, well, maybe I'm not surprised. I don't know. I'm really discouraged, maybe the word is, to see all these surveys coming out with an incredible amount of people, in my mind anyway, who say, without seeing any data, without hearing how the efficacy might be, say they don't plan to get a COVID vaccine if it's available. As a health professional, as somebody who deals with this, who knows what these diseases can do, I can imagine that's got to frustrate you and the people in your business.
Well, yes. I mean, I think the problem really is a very basic one and unavoidable, given the fact that this virus has reared its ugly head in an unprecedented way in an extraordinarily short amount of time, and people are scared. They're afraid of getting the virus. They're afraid that there's going to be a rush to produce a vaccine that really doesn't work. There's a lot of fear out there, and I appreciate that. I think that I appreciate the fact also that a number of companies that are working on the vaccine have recently put together a public statement saying that they will not do a rush to produce a vaccine unless they're sure of its efficacy. I think that distrust, as much as it might be disappointing, is understandable, given our circumstances. This is a very frightening time to live in a sense. You can, as well as I mean, we can go back a year and we went wherever we went and did whatever we did. And now the whole world has changed so suddenly. And I think a lot of people are afraid that a vaccine is going to be produced that won't do the job or potentially might be dangerous, so to speak. And I hope we can have enough faith in not only our government, but in our pharmaceutical industries worldwide, that that's not going to happen. So I think when a vaccine does come into the public forum, it will be one that at least has minimal efficacy and certainly doesn't do any harm. And I think that once that happens, I think the degree of fear will decrease. And of course, there'll always be some people who choose not to get a vaccine. And of course, there is human choice, which is acceptable. But I do think when all this plays out and we get a positive feedback, if you will, one that can be counted upon, I think people will change their mindset. I think right now there's just a lot of fear out there.
Yeah. And the final question, short of a vaccine, how are we doing? What do you hear and read from your peers regarding therapeutics? Maybe we're not in a vaccine yet, but I know with other diseases, with other bacteria, viruses, we tend to learn more about what works and what doesn't. How are we doing this?
Well, I'm glad you asked that question because I didn't want to end on a negative note. I do believe that a vaccine is going to come down the pipeline that will help the situation, certainly. But I think that therapeutically, the medical community has learned so much about this virus that they're doing so much better in terms of identifying high-risk patients, about early intervention, about learning what works and what doesn't work. We've seen a dramatic decrease in mortality rates. We've seen decreases in ICU admissions. So we can see that the whole profile now is moving forward to a more aggressive therapeutic approach. So that is a very positive thing. The other very positive thing is we are developing new testing methods. In fact, I'm working with a group of individuals who's working on a biophysical method of doing rapid testing on the virus from patient saliva where you could have the results in 10 minutes. So I think, and there are many other tests in different realms, but certainly in that same venue of looking at the virus and its presence and being able to determine very rapidly whether an individual has been infected. And I think that's going to change the entire profile of this infection. It's going to help us to identify individuals who are sick, help them very early before they become critical, and also help to spread prevent the spread of this virus in ways that are going to be very important. So I'm hoping that 2021 is going to be a much better year dealing with COVID and setting a precedent that we'll always be able to rely upon as we move forward in treating emerging viral infections.
All right, we end on a high note. Good to do that. Dr. Sarah Crawford, a Southern Connecticut State University professor of biology and a virologist, updating us on the COVID-19 coronavirus.
Thank you, Paul. I appreciate it. Nice to talk to you.